Good afternoon. Welcome to the policy session of the Phoenix City Council. Thank you for joining us on June 2nd. We will begin with a roll call.
Councilman DeCiccio? Councilman DeCiccio? Councilmember Garcia?
Here.
Councilman Nowakowski? Councilman Nowakowski? Councilwoman Pastor?
Here.
Councilwoman Stark?
Here.
Councilman Waring? Councilman Waring? Councilwoman Williams?
Here.
Vice Mayor Guardado?
Here.
Mayor Gallego?
Here. Thank you all for joining us. We will begin with our Assistant City Manager, Milton DeHoney, with an update on the city's response to COVID-19.
Thank you, Mayor. Members of Council, we're pulling up the presentation here. So we're going to Thank you. We're going to have a discussion on multiple topics this afternoon. Testing update, domestic violence update, human trafficking, and city services. There will be various people commenting as we move through, and so there'll be points in time when we'll have to pause in order to shift the monitor and those kind of things, so I just alert you to that at the outset. So let's first talk about testing for just a minute. You're aware that we have been providing testing opportunities for city employees through Banner Health. To date, we have had 75 individuals take the antibody test. That is the test to determine if they have been exposed to COVID-19 at some point and they have antibodies within them. And then 465 people have taken the PCR test. That is the swab test up the nasal passage to determine the presence of live virus. The testing is ongoing, and HR is pleased that we've been able to provide this. We've heard a lot of positive feedback from employees liking that the opportunity is available to them. In addition, you're aware that we've been in a partnership with Sonora Quest, providing community testing in Steele Indian School Park. Thus far, we have held testing on 2 consecutive Saturdays. To date, 224 people have been tested. There is another round of testing available that will happen this coming Saturday. The hours are from 8 a.m. until 12 noon, and that will accommodate both walk-ups and people that drive in. Additionally, we've been working to try to expand community testing opportunities. We've been working with our clinical partner, Equality Health, on a community testing opportunity that would take place on 2 consecutive Saturdays, June 13th and June 20th, in Desert Park West, 67th Ave, and Encanto. And again, the hours for that testing would be 8 a.m. until 12 noon. At this particular location, we're going to have an added twist in that we will make our census van available for people who may want to complete the census. This was an idea that Councilmember Nowakowski had. We communicated with Albert Santana, and they are able to make the van available, and so we're glad to be able to provide that. And now we want to pivot to begin our broader discussion, and I'll turn the presentation over to Jeff Barton.
Mayor, members of the council, good afternoon. So this part of the presentation will kind of revert back to our strategic plan for the COVID relief dollars. Again, remember we have $293 million that was allocated by you very strategically into 3 areas: $75 million for community investment, $75 million for city operations, and then $75 million has been held in reserve. Or I'm sorry, $143 million has been held in reserve. What we're going to do today is focus in on the portion that is under the $75 million community investment, specifically $10 million set aside for mitigation and care of vulnerable populations. If you recall our last conversation here, we allocated $3 million for refugee assistance, so that means there's $7 million still available in this bucket. And with that, I'll turn it over to Milton.
So thank you, Jeff. One of the items that we have talked about before is domestic violence. We did a 4-month comparison looking 2019 to 2020 between the months of February and May. What we found were some alarming increases, and we mentioned that to you in prior meetings. We've seen an increase in dispatch calls, ranging up to a high of 11.5% increase in a single month. We've seen an increase of incident reports going as high as 31.5% in a single month, an increase in DV-related arrest, a high of 27% increase, aggravated assault, nearly 35% increase in a single month, threatening and intimidation, and then criminal damage. We attribute all of these increases essentially to the impact of COVID-19, because during the 4-month span that we've been looking at it, this is when people have lost jobs, they've had reduced wages, they went through a period of few months of being essentially shut in. Schools were closed abruptly, not leaving parents much time to make arrangements. There have been several instances of people needing food assistance. Social amenities have been taken away. And when you put all of those together, we were concerned before that this would occur. The data shows that it is in fact occurring, and so we formed a team to start to work on this. The first thing that came was the development of a major awareness campaign entitled Domestic Violence Help. We had partners with radio stations, television stations, billboard owners, and then 2 institutional partners, the Arizona Coalition to End Sexual and Domestic Violence. You will be hearing from their co-CEO a bit in a few minutes. And then also we were able to form a relationship with the Arizona Broadcasters Association. And so this awareness campaign is ongoing, but moving beyond that, we wanted to focus on what additional could we do to help mitigate the situation that we were seeing. And one of the things that we came up with is the intent to expand access to help. And from that, we came up with the idea of dedicating computers that are connected to the court system. This idea was presented to the group by Judge Don Taylor. Judge Taylor is here today, and I'd like to invite him to talk about the idea that he presented.
Sure. Mayor, members of the council, as you may be aware, anyone who is a victim of an act of domestic violence, whether it's reported to law enforcement or not, can actually seek an order of protection from the court. And that can be a powerful tool. What the court can do is that the court can order the offender not to have any contact with the plaintiff in that case. We typically receive petitions that we act on several hundred times a month for orders of protection. And that has really up until now required the individual to come down to the court. We have for many years had a dedicated link with the Family Advocacy Center by video so that individuals could be with advocates there at the Family Advocacy Center and have that actual hearing, that appearance in front of the judge by video, and that's worked well. But what we'd like to do now is really expand that footprint geographically. You know, Phoenix is pretty spread out. It can be difficult for some people to travel all the way down to the downtown core in order to be able to actually have that hearing. What we'd like to see is a dedicated video link in a number of different places around the city that would allow someone to actually be able to have that hearing with the court by video link in a safe location, looking at different locations around the city that would not require them to come all the way down to the court. As I said, we've had this for a while with the Family Advocacy Center. We'd like to see that expand. We think it would be very helpful to people out there who have difficulties traveling down to the court.
So again, Mayor, members of council, this is something that we've traced back to the onset of COVID-19, and in order to get the pilot off the ground, we would seek approval for $75,000 for technology. That is to acquire the computers that Judge Taylor is talking about and to place them in various locations that would make it easier for people in neighborhoods to be able to access what the court can do for them. In addition to trying to launch this, we continue to work with our external partners, and the Assistant City Manager, Deanna Janovich, will talk about the relationship with our partners and what we would like to do with them.
Thank you, Mayor, members of the council. As Mr. Dahoney indicated, we have had lengthy discussions with our domestic violence partners. Joining me today for the presentation, as Mr. Dahoney said, is Tasha Miniker, who will serve as our point of contact for the domestic violence providers. As we spoke with them, while we're in the midst of COVID-19, there is an increasing difficulty to provide the services that we need to provide, as well as offsetting increased costs for what they're having to do at their agencies. In addition, the coalition is going to, as I said, serve as a lead agency to provide the funding to each of the organizations that reside within the city of Phoenix. In speaking with each of the agencies, I'm going to walk you through what they had as their greatest needs as an organization. So with Chicanos por la Casa, they're really needing welcome boxes for housing clients. They also had a need for additional infrastructure improvements to assist with the social distancing, as well as sanitation supplies and deep cleaning assistance on a regular basis. They were also looking at laptops for the families, given the current situation and the distance learning. They had additional needs for some COVID staffing to help manage in this crisis, and so they are requesting approximately $140,000. For Chrysalis, Chrysalis does maintain multiple facilities throughout our city, and so they too are looking at shelter supplies, as well as some additional technology improvements, assistance with infrastructure and things they need to do to modify some of their locations, as well as additional COVID-19 staff, and they are requesting approximately $530,000. Working with Doves, they are in need of emergency client needs, as well as some transportation assistance, and they are requesting $25,000 to assist with the COVID-19 crisis. Shelter Without Walls is looking at approximately $15,000 for shelter supplies, $5,000 for transportation needs, $5,000 for food assistance, and so they are requesting $25,000. Sojourner is asking again also for shelter supplies and food assistance at $30,000, as well as some transportation assistance for $5,000, and then an additional $170,000 for infrastructure. And as well as some emergency client needs at $10,000. They are also asking for pet parent assistance at $5,000 and deep cleaning assistance at $40,000. And so their total request is $260,000. And then again, as I said before, the Arizona Coalition to End Sexual and Domestic Violence is going to help us assist with each of these agencies and get them under contract for the COVID-19 assistance. And they are also requesting some COVID cleaning supplies at $5,000, infrastructure at $5,000, emergency supplies at $20,000, and transportation assistance at $5,000. Their total request is $35,000. And so just to give you a snapshot at each of the organizations and what they have requested, the total COVID-19 CARES Act Domestic Violence Assistance Plan is approximately a little over $1 million. And with that, I'll turn it over to Tasha Miniker for a few comments.
Yes, thank you, Mayor, Council members, again, for your continued focus on domestic violence and the needs of survivors. I really am here just to say thank you. We appreciate you considering the ongoing needs of survivors at this time. We do anticipate that the programs are going to have to continue making adjustments and considering sanitation and social distancing in order to ensure all survivors are kept safe and healthy. So this funding could be very important and useful to both us at the coalition and shelters to maintain that level of safety. So thank you, and I'm here if you have any questions, and I believe we have the executive directors of the programs on the call as well, if there are any questions about any of these requests.
Wonderful, thank you. Thank you to our staff for working hard to address these important issues, and thank you to Tasha, who has been, I think, one of only 2 people who have joined us on multiple council meetings during COVID-19, but I believe this is a plan that really reflects the testimony that, Tasha, you provided to us a few weeks ago and provides critical support to our nonprofit partners who are doing so much during a difficult time to address a real community challenge that we have felt personally at the city, and one that responds to the deep challenges within our community. So many have sacrificed so much to get through COVID-19, and hopefully this can be a way we can support nonprofits that are doing very, very crucial work during this time. I think I will turn it back to Deanna Jonovich to introduce the second portion of our presentation.
Thank you, Mayor and members of the council. We also wanted to reach out to our partners and the work that the mayor and council has embarked on in addressing human trafficking. As you know, Phoenix is recognized as a leader in raising awareness. We have also made significant progress in coordination of our resources, and there is a need for increased support during the COVID-19 pandemic. So again, in having conversations with our partners, we wanted to first take a look at our Starfish Place and really evaluate what was needed in that location. We are looking at about $60,000 in personal safety and protection funding. We also have families and children in that location, so we're really looking at connectivity and distance learning for approximately $120,000, as well as some additional family support for $30,000. Some community safety and facility management improvements at approximately $40,000. And so for the Starfish Assistance Plan, we are requesting $250,000. Also with our Phoenix PD Heat Unit, Phoenix has seen an uptick in sex trafficking in the past 2.5 months during the COVID stay-at-home orders, and so we are looking at some additional efforts in that area and requesting additional funding for the work that Phoenix PD does to try to alleviate human trafficking. So we have additional monies for the hotel rooms, as well as some computer tablets, along with some family supports and travel funds, and so that totals approximately $20,000. As you know, we have also been very successful with our pop-up drop-in centers, and again, as a result of COVID, we are having to modify those efforts and do those a little bit differently. And so the group is requesting additional personal safety and protection for $6,000, some transportation assistance for $5,000, as well as some food assistance and outreach materials, along with some additional outreach staff, and so that total request is $40,000. To sum it up, we are requesting approximately $310,000 as a result of our COVID-19 efforts with our human trafficking plan. Again, we have joining us by phone Dominic Rowe Sepowitz, who has led a lot of the efforts within the City of Phoenix to address human trafficking.
Hi there. I just wanted to make a thank you, council members and the mayor. I wanted to thank you also for your interest in human trafficking. We have seen a significant increase in trafficking on our streets during this time, which was unexpected. And our clients have been disproportionately affected by wage reductions and loss. The children in the programs at Starfish Place have all lost their daycare and their schools. So we really appreciate the assistance of making sure that these clients continue to work towards healing and work towards success. So thank you again for involving me and ASU in our ask, and we look forward to supporting these sex trafficking and labor trafficking victims.
So, Mayor, members of the council, what we are requesting here today is approximately $1 million in domestic violence funding and $310,000 in human trafficking funding. And with that, we'd be happy to answer any questions.
Thank you. Thank you to our staff for joining us today. I will go to Councilwoman Williams in a moment, but first wanted to recognize that shortly after roll call, Councilman Waring and Nowakowski joined us. Councilman Nowakowski, we want to thank you so much for the great idea about getting our census van out and in the community as we fight COVID-19. Really appreciate that. Want to thank our staff for reaching out to these providers again. Thank you to Dr. Rowe Sepowitz for being a resource to me, and to Councilman Waring, to whom I will turn for a motion, as he has led our human trafficking effort, and I think we would not have this on our agenda today had he not continued to focus on the fight against human trafficking, and how it, like everything else, has been complicated by COVID-19. Everything that was difficult before COVID-19 has obviously gotten even more difficult as we fight the virus, but our important work continues. Thank you to our city department heads, ranging from Judge Taylor to Cindy Stotler, who have worked again to provide innovative solutions. City departments from our courts to our housing department have gotten national recognition for the innovative work that we do here, and it makes me proud that we are continuing that even in these more difficult times. So I will go first to Councilwoman Williams and then to Councilman Waring.
Thank you, Mayor. I'm very proud that you're going ahead with this. I think it's very important. It's essential services. But my question is, how do we get the word out that all of this is available to people that are experiencing this?
Mayor, members of the
judge, how do you know to use the computer?
Mayor, members of council, Councilmember Williams, we are going to be using the external organizations to help get the word out about where the locations are. We have to do it in such a way so we're not being, I guess, right out in the open with where these places are. So there is a level of discretion that you need to communicate throughout the DV community, but we will use our partners to help spread the word. And if the pilot is successful, as we all hope that it will be, the judge had said from the outset it would be good for us to expand it. And so if we get good traction with these 10 to 15 initial locations, then we'll be looking to add more.
Can you also tell the police officers, the ones that most likely respond to these calls, about their additional services so they know how to refer people?
Mayor, members of council, Councilmember Williams, yes, there will be appropriate communication within law enforcement circles. Also, they would be aware of where the locations are. The real value to the idea is a person that may on any given day decide that I'm willing to take that step to try to get help, may be able to go to a location that's close to them rather than having to come to the downtown area, and then being able to communicate directly with the court system while they're in front of the computer to seek the order and also participate in the hearing is the additional value that we think the pilot will provide.
Good advice, Councilwoman Williams, and thank you, good suggestion. Councilman Waring?
Thank you, Mayor. I appreciate it very much. I appreciate your gross overstatement of my influence as well in your opening remarks. I will say we wouldn't be here, me having nothing to do with it, we wouldn't be here without, frankly, Mayor Stanton, having started us on this course of focusing on human trafficking, and then you continuing us on that course, which I've always appreciated. You and I sometimes have differences, but I have appreciated you have continue to make this a focus. And you and I had talked about how best to utilize available resources. Obviously, this is a vulnerable population. The stories, a quick Google search, and you'll see that this virus, coupled with people's sadly all too common proclivities to hurt each other, have really have led to some disastrous situations as people have been thrown together and kept together, perhaps even unwillingly in some cases. So the normal options of escape for people have not been available, and tragedy can result. And so I think this is the right course. We had talked about trying to utilize available resources to advance the ball on an issue against all odds when it seems darkest. And I think this plan does that. And, I appreciate you including me in your efforts very much. And I'm happy to make a motion if you're ready, but if other people have questions, then wait, whichever your druthers.
We are ready for a motion.
Okay, I move approval of the staff recommendation.
Second.
Wonderful. Motion from Councilman Waring and second from Councilwoman Stark. We're going to go to additional council member comments, and then we have 6 distinguished leaders who have been working on these issues who have joined us telephonically, and I wanted to warn Tasha that I might ask her in a moment to repeat the excellent advice that she gave us previously for if there is anyone who is in an unsafe situation, what are some resources that are out there. But first I will turn to council members who have such a passion for these issues. Councilman Nowakowski?
Thank you, Mayor. Mayor, first of all, I just really want to thank our staff for all their hard work in making this happen. The other thing is the pop-up COVID centers. Just really want to thank you for looking at the Maryville area and making sure that all those areas that are being hit the heaviest, that they have an opportunity if they have insurance or if they don't have insurance. That's something that's really, I want to thank people for that. There's many people that want to get tested, but they're just afraid that they're going to be asked for insurance information. And I just want to make it very clear that if they come out to Desert West Community Center, that if you have insurance, if you don't have insurance, you're able to get tested. And then we're going to have more information on how to register and how to get that all done. So thank you, Mary, for your leadership on that. And I just want to thank our staff for looking at those other areas also of our city.
Thank you, Councilman. If cities that take this seriously will get through it more easily, and we need to make sure everyone in our community has access to health care. The virus does not discriminate, and appreciate your leadership in addressing the distribution of tests, because we do want people to be able to get that testing. Tasha, can I turn to you, and could you speak to us about if people are at home in unsafe situations, some of the resources that are available?
Yes, thank you, Mayor. I do just want to remind everyone that programs continue to be open, the shelters are open and available to survivors, that the council does have, that you do have platforms among yourselves to continue to spread the word about available resources. Survivors are really struggling right now, whether they're actively experiencing abuse or they've recently escaped abuse and looking for resources. We know some of our programs have spent the majority of their time helping survivors connect to simple things like food and housing. So please continue to spread the word, to let folks know they can call the National Domestic Violence Hotline, they can call the National Sexual Assault Hotline, and they can call our helpline at the Arizona Coalition to End Sexual and Domestic Violence. And we're happy to connect them and their children and their pets to programs that are here locally.
Wonderful. Thank you. Thank you for continuing to remind us. And council members have been working hard to spread that information, but we cannot repeat it often enough. So appreciate your partnership. We will, if no other council members have comments before we go to the phones, we will begin with Patricia Clark from Chrysalis, and then go to Gerardo Pena from CPLC. We can hear you. Yes, the floor is yours. Thank you for your service to our community.
Thank you. Thank you, Mayor Gallego and the rest of the council. This is unfortunately a sad and exciting time for us, because nobody should have to be dealing with COVID, let alone people who are in such a difficult situation and living very close to one another. These funds are going to give us the opportunity to practice more social distancing, to be able to have clean, healthy environments, and not that we don't now, but just to be able to do it in a very deliberate way and mindful way, and be prepared that if this happens again, which we need to be prepared for that we have it all ready. And so one of the things that we are really excited about is to be able to use touch-free, whether or not it's touch-free bathrooms or, touch-free faucets, to be able to have that opportunity. And I think the other piece is that nobody chooses to be in a domestic violence shelter, especially during this time. And as City Manager Doherty said, is that the incidence of abuse is just even higher and higher in different ways. And we have to be able to find safe resolutions for them. And I know for our other programs that are non-residential, we have anywhere from a 5 to 7 week wait list, because we're still providing services in a telecommute way. And so this is it's going to be able to provide even more depth and breadth for that. And I think the other thing I just want to call out is that our staff are the unsung heroes who are working the front lines in the shelter. And they're having to do a lot of the cleaning, and it's hard on staff. And so this is just an amazing opportunity for us. And so I thank you all.
Wonderful, thank you. And please give your staff our thanks on behalf of the Phoenix City Council. We will go to Mr. Pena, followed by Alice Garib.
Hello, can you hear me?
We can.
Wonderful. Mayor Gallego and council members, thank you so much. And just to let you know, we truly, truly appreciate this opportunity to better serve our clients. At Chicanos por la Causa, we really pride ourselves in having the ability to serve this underserved population. So access to a safer and cleaner environment not only is going to allow our clients and our staff and our participants to feel more at ease, but also just allow them to know that we truly care for their safety, and we really want to put every effort out there to make sure that they feel protected and they feel that we have their best interests. So the access to these additional funds is truly going to allow us to provide those that ability to show how much we truly care for these folks, and it's going to allow us to provide even more access. I truly repeat everything that Patricia said in terms of the population that we're serving and how truly our staff are I mean, they're there every day. They're at the office, they're working, they're having face-to-face contact with people that truly need their support. So they truly are the heroes. And I think this will also help our frontline staff feel comfort. So thank you so much, Mayor and council members.
Wonderful, thank you. And I think for all of our providers today, please do tell your staff that we appreciate the hard work they're doing with even more challenges than normal. We will go next to Alice, followed by Linda Scott. Alice, the floor is yours. And I see Alice we keep going mute and unmute, but it looks like Alice is now unmuted. Alice, can you hear us? I cannot hear Alice. Okay, we will then go to Linda, followed by Cindy.
Good afternoon. Can you hear me?
Yes, we can.
Thank you. And thank you, Mayor Gallego and members of the council. I'm Linda Scott with Jewish Family and Children's Service. And I can't tell you how appreciative, as you've been hearing from previous speakers, we all are of your attention to this issue. We have seen such an increase in our community with this pandemic in the tensions in families, the eruptions of abuse, the return to even more psychological and financial kinds of abuse in addition to physical. We are, really struggling with folks who have lost their jobs, and in order to even have a shot at being able to be independent in a safe housing situation outside of a shelter, they are really struggling just to get basic needs met. We're attending to the needs of children and small families and large families, and it is just, I think, this is a long haul issue, and I think the willingness of the city to think about how to help those of us out here who have staff who are really in the trenches with folks who are being abused and surviving abuse right now is a blessing to us all. And I just want to say thank you. This is very needed support.
Thank you. Thank you for all you are doing. We will next go to Cindy.
Good afternoon. Can you hear me okay?
Yes, we can.
All right, just checking. So I think this is Cindy Kenville, Sojourner. Thank you, Mayor and City Council members. Wonderful to see many of you again. It's been a while since I've been with the City Council. So I'm fairly new to Sojourner. I've been here just a little over a month, so I came in the middle of the COVID-19 crisis and to see how I can help and support the team here. And I have to say they've done a fabulous job. But my concerns coming in, it's been the long term and the long haul, and it's really, really great to see the city stepping up and understanding it's not just about today, it's about the future and how can we continue to support these families in crisis and our pets. So I just want to ditto response to everything that others have said and wish you all the best as we continue to monitor our way through this unknown.
Wonderful. Thank you, and thanks for being willing to take on a new job during a challenging time. We'll turn back to our staff. Do we have Alice?
Alice, can you
Okay,
try to speak again, please? If you can take yourself off of mute and make sure that your computer microphone is on. I'm sorry, Mayor. We're not connecting with her.
All right, well, thank you, Alice, for trying to join us. Council member comments? All right, roll call.
Councilmember Garcia?
Yes.
Councilman Nowakowski?
Yes.
Councilwoman Pastor?
Yes.
Councilwoman Stark?
Yes.
Councilman Waring?
Yes.
Councilwoman,
Yes.
Vice Mayor Guardado?
Yes.
Mayor Gallego?
Yes.
And Mayor, that motion passes 8-0.
Wonderful. A unanimous vote to support our great nonprofit partners who are fighting human trafficking and domestic violence. Thank you for the work you do. We will come back now for agenda item 3, which is the city services update, and I will turn it back to our Assistant City Manager, Milton Dehoney.
Thank you, Mayor. So we'll now transition into the latter part of our presentation today, the city services update. You'll recall that we spoke to you on May 19th during a work study when we were talking about reopening and all of the different facets that was included in that. During that discussion, we observed the status of Parks and Recreation, the libraries, and our Human Services Department. Going first back to Parks and Recreation, the current status is closed, and you'll recall that we indicated that in order for us to have swimming pool availability this summer, the Parks Department needed a 30-day lead time in order to get the pools ready, get the staff assembled. There was comments made at that time that the latest estimated or recommended start date would be July 4th. There was also reference to the recreation day camps, which today are only serving the children of city employees. But in order to broaden that to the entire city, we needed 21 days notice to get that ready. And then field reservations with limited participants, just 1 day's notice. In addition to Parks and Rec, we talked about the library. The current status, of course, is that all the library facilities are closed. We have been operating a curbside pickup service for 2 hours between 8 and 10 a.m. The library system has been receiving feedback from their client base indicating the struggle to make it within the 2 hours, and so they are wanting to expand that. The next level of service delivery would be what they call grab and go, needing 7 days notice in order to make that active. That's where people would be able to go in and pick up items that they have on reserve in addition to dropping off items that they may have previously checked out. And then the reopening of all of the facilities would need a 21-day notice. And even then, we would be talking about limited capacity with pools, limited capacity within the libraries. And then we took note of the fact that all 15 of our senior centers are currently closed and pointed out that we would need between a 30 and 45-day notice in order to reopen them. And especially since we're talking about a vulnerable population with regards to senior centers, we'd have to pay close attention to the capacity and the activities within the facility. So then we pivoted and we presented you with a series of metrics at that meeting, at the work study. And we talked about a way to review the data that was available. We pointed out that Getting data that's all the way down to city-specific is very difficult. It's at the state level, and the best we can do in most instances is get county-wide data. And so we talked about 14 consecutive days of decreasing positive cases of COVID as a measure that might be looked at, 14 consecutive days of maintained or reduced percentage of positive tests, 14 days where the percentage of ICU bed use was either maintained or decreased, 14 days of hospital admissions for COVID-like symptoms was either flat or decreased, and 14 consecutive days of declining death occurrences. During that conversation, Councilmember Pastor asked a question about tracking of COVID's impact on children. And then that started us to take note of that particular demographic, and the way that it's dealt with is from 0 to age 19. And so from the last time we were here talking about it until today, we're showing you 31 days worth of data, first on the daily COVID cases. And even if you can't clearly see the numbers, you can see that it's an up and down picture. It might decline for a bit, but then there's tended to be a resurgence. With the percentage of positive cases in Maricopa County, this particular metric is tracked by week, not by day. So you're seeing the week's activity starting with April 5th, moving all the way into May. There has been a gradual decline in this particular metric, so to the naked eye, it's certainly going in the right direction. With regards to ICU admissions, like other metrics, it has not been declining. In fact, it has been graduating up. We did have one day where we didn't have ICU admissions, which is positive. And then daily hospital admissions with COVID-like symptoms. There hasn't been, the broad swings like on some of the other areas. We did have one day where there was quite a spike. Fatalities reported by day, again, it has been an up and down picture. We've had some days here and there where there were no reported deaths, only to be followed by a day where there were 10, 15, or 20 deaths following it. And then the newest metric that we started looking at was the impact age 0 to 19. And like some of the others, it has been an up and down swing based on what the data is showing us. So based on the data that's been presented, the only metric that has been moving steadily downward is the percent of positive cases by week. The present status is libraries and senior centers, athletic courts, and recreation centers. They all remain closed. We mentioned during the work study that the pools are the most sensitive item based on time. And so if we are going to have swimming, we need to make a decision about that. I've been joined at the table by Parks Director Inger Erickson, and she's going to talk to you a little bit more about the situation with pools.
Thank you, Milton. Mayor and members of council, today I'm here to talk to you about the swimming pools and the uniqueness related to pools as it relates to managing risk related to COVID-19. As you see on the slide, there is no evidence that the virus can spread to people through water in pools, and that's from the CDC. Also, properly treated pool water inactivates the virus, again, noted by the CDC. Pool chemicals are tested hourly in our system. We would post signage at the entry points related to things like the distancing. Also, if you're not feeling well, if you have symptoms, please don't enter, those kinds of things on the sign. We would need to limit our attendance by 75%, and that's, again, to allow for people to stay separated from each other. We would have reservations only we could manage it this way if we were able to have pools this year. Walk-ins could also happen if we were under the capacity level, and so that's something that could happen too. And reservations could be made in multiple ways, and we could figure those details out later, but either online or via the phone or walk-up. We would have specific time blocks, and then in between those time blocks, we would clean for 30 minutes so that we make sure that we're addressing those issues as well. We would also modify what we currently allow to happen, which is right now 7-year-old and older can come to the pool unaccompanied. But because younger kids can't really do that on their own, the social distancing, we would say that 12-year-olds and under must be accompanied by an adult. Next slide. So a proposal we would have is that we could do July 4th. That would give us our 30 days time to get staff in order and get the pools filled that need water put in them, the chemicals balanced, those types of things. And we could open 16 pools of the 29 that we normally have for an extended season that goes into August. Normally we would close at the end of July and early August. We would operate 12 to 6. We'd be closed on Fridays as we typically have been over the last several years. We do have 356 staff that are returning that we know are available and have indicated they are still available. This would be for open swim only. There would be no lessons or no swim team. And because we do have Cool Kids money, we could allow the kids to swim for free. And so I say that with giving you an option to safely operate pools. One of the things that CDC also says is that they give some guidance on visiting parks and recreation facilities, and they say play it safe in and around swimming pools, keep the space between you and others. And so they do give guidance that says there's things you can put in place and measures you can put in place to safely open pools, but those things have to be in place and you have to limit the participation.
Mayor, members of council, this concludes our presentation.
Wonderful, thank you.
Can I ask a question?
Councilman Waring.
Thank you. So Inger, you and I had talked about this, but I'd also, done some reading on my own, and obviously I've read some of the same things that you and I have talked about yesterday. One thing I neglected to mention, though, was some of what I read was the danger isn't the pool. It's more the bathrooms and the locker rooms and the changing areas around the pool. I haven't been to every city pool, so I don't know what the circumstance is, but I'm sure we'll be doing all the deepest of cleanings and so forth. But maybe I missed it in your presentation. I'm sorry. I was curious, like, how are we going to manage that? Because that's different than like just the swimming in the pool or even being next to the pool.
Absolutely. Mayor, members of council, Councilman Waring, so in that 30-minute period of time that we would have in between the swimming blocks or the swimming time sessions, that's when we would do some deep cleaning of the pool restrooms. Now, you have to have showers according to the Maricopa County Health Code because people have to have the ability to rinse off before they get into the pool. However, we do have staff that are always in the office, and there would really never be a reason to hang out into the bathroom. People would come out onto the deck. We would have staff that would encourage kids to leave the restroom if they were hanging out in the restroom. But again, the restroom would be there primarily for someone to quickly rinse off as required by Maricopa County, to use the restroom as necessary. But we don't have lockers in our facilities, so there's no real reason to hang out into the bathroom for any other reason.
Have concerns, Mayor Inger, about those facilities. Like if they want to, it's going to be fine, as much as could be anyway.
Thank you, Councilman. I think that's a very important question. Councilman Nowakowski.
Thank you, Mayor. You talked about 16 pools being opened. Which are the 16 pools that you're thinking about?
Mayor, members of council, Councilman Nowakowski, we have looked at a map and tried to make sure that we distribute opportunities throughout the city. So the list would include Cortez Pool, Deer Valley Pool, Telephone Pioneer Pool, Paradise Valley Pool, Sunny Slope, Salito, Encanto, Falcon, Maryvale, Starlight, Pecos, University, El Prado, Harmon, Hermoso, and Perry.
Alrighty. And then the other thing is, we talked about social distancing, that as long as you're in the pool and you're spread out 6 feet from people, that the virus doesn't spread through the water, especially with the chlorine and all that. So are we going to have our lifeguards kind of helping with that social distancing? Because I know kids, when they're playing in the pool and they're having a good time, it's going to be kind of hard. It's even hard as parents trying to discipline your kids at home. How do you control that in a swimming pool area with a bunch of kids having a good time?
Mayor, members of council, Councilman Nowakowski, because of the reduced capacity that we would have, for example, I'll just pick Salito Pool. Normally, the capacity there would be about 500, but because of social distancing and the amount of space and the requirements we'd have there, it'd be reduced to less than 100 people at a time. And so it's easier to manage that. Plus, there's always the pool manager, there's cashiers. We do also have some other staff from other programs that we could redeploy if necessary to help with those things so that the lifeguards could do the job of lifeguarding.
So we'll have people doing kind of double duty, right? Making sure people are keeping social distance.
Absolutely, double duty, and then maybe some extra staff too that we could redeploy from some other locations.
Alrighty, thank you.
Thank you, Inger. I am planning. Okay, Councilwoman Pastor.
No, go ahead.
Wonderful. Perhaps we are on the same wavelength with the question, so I will try it. This Centers for Disease Control guideline is important to me, and the fact that they have said that we can do this safely matters to me because I want to make our decisions with public health data. As a former lifeguard yourself, Inger, you know that lifeguards are highly trained. Will we have the ability to share the CDC guidance with all of our aquatics employees and make sure that they're familiar with the best practices from health experts?
Mayor, members of council, absolutely. In fact, there would be specific training. If we know today or tomorrow that we're opening pools, we start training tomorrow. So we're set and we're ready to go.
Wonderful, thank you. Councilwoman Pastor.
Thank you, Mayor. Mr. Dohoney, I believe it was 2 weeks or 3 weeks ago when we were talking about opening the pools and that we were going to look at the data and looking at the cases and COVID-19. As of today, we are higher than New York at this moment. And so what I'm hearing, and I want to know from you, are you recommending to open the pool or from staff?
Mayor, members of council, Councilmember Pastor, we are presenting what the data has shown us over the past 14 days. Based on what the data is showing, we're not recommending that, but what we're doing is to make sure that everyone is aware. Because of the time sensitivity around the pool decision, we're simply drawing your attention to make sure that if in fact you want pools open, that has to be decided so that Inger would be ready by July 4th. Otherwise, we lose the season regardless.
But with the presentation, it sounds like staff is recommending to open. So that's what I would like to know. I would like to know what staff is recommending.
Mayor, Councilwoman Pastor. So I think the council asked us to show data on those 6 different indicators, which we did. If you simply wanted to follow that, that would recommend that you would not open them. However, there are other considerations for that, particularly with pools, which are a different situation because they're outdoors, and also just because of the fact that it's hot in Phoenix, so hot in the summer. And there have been some expressions of wanting there to be something for our young people to do, both in terms of employment and activity. So it really is a policy direction of the council to evaluate beyond the data whether there are other factors that make it warranted to open the pools in this limited case. The Parks Director has indicated how she could do that as safely as possible, but really it is a policy question for the council.
So to the city manager, my question to you is, 2 weeks ago, I was very clear 2 weeks ago, and we can pull the minutes out. And what we were going to be judging, or how we were going to be looking at this, is with data. And what I just heard was that we're shifting, because the data is not showing that we should be opening, but we're shifting so that then we can not circumvent the data, but the way we give a justification for opening a pool. Now, you spoke about employment. There's other ways that we can employ these young youth that are lifeguards and be able to employ them in different ways, and we reallocate in different departments, or we could also be able to do some census outreach and get people out in the ground like we're doing right now, dropping off flyers and encouraging people to sign up for census. There's many different ways how we can employ the young youth, which I don't want to put at risk in risking them getting COVID-19. So I would like to understand what you just told me.
So based purely on the data, we do not have 14 days of declining indicators. However, because this is a decision of the council, you use data as one factor for making your decision, and ultimately the council gets to make the policy decision as to whether, in this case, swimming pools should be open in the summer. The Parks Director has indicated how she would do it as safely as possible, and ultimately the council needs to decide, weighing the data and other factors that you might consider, as to whether you would want to open the pools, or, as you say, find some other employment for the youth. But the pools are really about both. They're really about people having something to do, as well as employing 356 lifeguards. But ultimately, it is a policy decision for the council as to whether it is time to open the pools.
Mayor?
Yes, go ahead.
Director Erickson, what are you recommending?
Mayor, members of the council, Councilwoman Pastor, if the direction is given, I can safely open the pools with guidelines that I've been given by the CDC, working with the National Recreation Park Association. There are measures we can put in place to make this a safe summer if the pools are to open.
Thank you.
Thank you, Councilwoman Vice Mayor, and then we'll go to Councilwoman Williams.
So I mean, I think, Inger, we've had this conversation before plenty of times. So I just want to make sure that whatever it is that we decide to do, that we do it with the highest degree of precaution for public health. I understand that right now we live in two different worlds. There's the parents who will not take their children out to the pools, and I understand and respect that completely. However, there is also parents who will, and I believe that we need to keep them and their children as safe as possible as well. I believe that we need to keep them and their children as very safe. We need to, I am very, like I said to you before, I'm really nervous and wanting to make sure that we're able to get our children back to school when school starts again. They've been out of school since March, and I would hate for us to see another high peak because of this, and I would hate to see us responsible for this expanding as well. So with that, I also know that opening up the pools, and I also want to understand if it's even worthwhile opening up the pools, because now we're saying that if we open them up, we wouldn't be able to open them until after 4th of July weekend, and then a lot of the pools would shut down after a month, and then we would only be open on the weekend. So I'm not exactly sure if it's even worth
the money putting into it, given that it's going to be less than 30 days that people would be enjoying the pool. So with that, I just have some specific questions. And I still don't understand, how is it that we get children to social distance? Are we going to have extra staff there? Like, how many per pool? How many kids are going to be are going to be allowed in the facility?
Mayor, members of council, Councilwoman Guadardo. So I have a list of each individual pool, and so on the very lowest end, Telephone Pioneer, their capacity at one time would be 15 people. Pretty easy to help those people stay socially distanced. On the highest end would be Pecos Pool, and that pool could accommodate upwards of, because of the deck space and the area, could have about 250 to 280 folks at one time, where normally they would have 500. And so we do have some other resources, our after-school program individuals that have been helping us do some maintenance out in the parks. We could deploy some of those. And again, I think we have plenty of staff that we could educate the kids. They would come for an hour-and-a-half block at a time. If they're not there with their parents, they're going to be a little bit older. They're going to be 12 or older. And so I think we rely on the parents for the younger kids to help us with that as well. And so I think there's ways we can mitigate the social distancing between people who are not of the same family or the same household.
And then other question is, what's our plan for testing the lifeguards, and how often are we going to test the lifeguards? How often are we going to test the staff? Because as we know, children can be carriers of the virus and pass it on to adults. So what type of testing are we going to be doing it, and how regularly are we going to be doing testing with the staff?
Mayor, members of council, currently we would work with HR on the staff piece of that because we want to be consistent with what's happening across the city and make sure that we're following the proper guidelines there. So right now there isn't any testing required of employees. However, there are questionnaires we can give not only to the employees but the participants. Asking them questions about, have you been having these symptoms, those kinds of things. We can develop those types of systems. We can work with HR to get that for the staff for sure. But right now, we would be kind of stepping out on our own if we were to say we were testing lifeguards, but we can work with HR on that piece.
And then my final question, and I guess I'm just like really concerned because I know out of the Parks Department is where we have the highest number of people that have been infected with the virus. So I'm a little concerned about that as well. But are we going to be testing? Are we going to just take people's word that they don't have any symptoms, or are we going to be testing people when they come to the pool? Or are we taking their temperature?
Mayor, members of council, Councilwoman Guadardo. So there are lots of organizations out there that recommend a temperature check. And so we could look into that option as far as taking temperature. But again, we don't take temperature of anybody else coming into any other city facility. So we want to make sure that we were doing appropriately and just not one group of the community, right? So we could work through that detail as well.
Okay, thank you.
Thank you, Vice Mayor. Councilwoman Williams.
There we go. Everywhere I've seen, I get my temperature taken, or I see them taking a temperature. I think it's very important that we provide recreational opportunities for kids. I think the Parks Department has come up with a good plan. I don't care about the adults in other places. I think it's important that we ensure that kids going into the pools or adults have a temperature taken, that we know that they are considered safe. So I support opening the pools and taking temperatures. Thank you.
Mayor, Councilman Williams, and Councilman to Vice Mayor Guardado also, if that is the direction of the council, we will work to implement a temperature check as part of our screening. If the council desires to open the pools and tells us to do that, we will add that temperature screening to our protocol.
Mayor?
Councilmember Garcia?
Yes. It doesn't make sense to me to reopen the pools. We're going to expend more resources that we already don't have because of COVID to move to the pools to put people at risk of potentially getting COVID. We are experiencing in the last week the highest numbers we've had so far. So I don't think it makes sense at all. I want to thank you, Ingrid, for doing the work and finding ways and possibilities of us being available to open this up, especially for our low-income communities. I mean, I grew up waiting until the summer so I could run to the pool, and it was the first thing, and I loved it, and I was there every day in public pools. But I know that I would walk there since I was, 10 years old by myself. I would not have my parents around, and I don't see how we're able to keep social distancing. It feels like we would have to go out of our way, spend more resources, and at the end of the day, not fully protect people and putting them at risk. And so I just simply don't think it makes sense to reopen the pools.
Thank you, Councilman Nowakowski.
Thank you, Mayor. Mayor, I have a couple questions. Number one, Inger, the reason it takes us 30 days to open the pools, it's for the training of the lifeguards and all that. Is that correct? Or is there something else that?
Mayor, members of council, Councilman Nowakowski, indeed, training is one of the components. We do have 5 pools right now that are empty, that are on that list that we would need to fill and balance the chemicals. So it'd be those types of things too.
I was just wondering, I agree with Councilmember Pastor, the Vice Mayor, and Carlos, is that practicing social distancing and opening up the pools while the numbers are going up, it doesn't really make sense. But I was just wondering if, let's say tomorrow it starts to decline and the next day it declines, and then it starts looking that we have 14 days straight that it's declining. Is there a possibility to have something on standby where if we start seeing a decline that we can open it by the 4th of July or so, and maybe rush that 30-day process, or maybe even having the lifeguards like Councilmember Pastor was saying, and maybe have them doing other duties within the city, which is helping with the census or so, and hire them on board, but maybe doing other city jobs while, if we do need them, they can jump on and become those lifeguards that we need. Just an idea.
Mayor, members of council, certainly we could start training folks now, and if we don't have a season, they were trained and they just didn't use that training this particular year. A lot of our lifeguards come back every year. We could start putting the water in the pool of the 5 that don't have the water, and if we didn't use it, we would just empty the pool again. I mean, there's certainly those options if that's the direction.
Mayor, I would like to see it where if it is a decline that we start looking at those options, but now that it's increasing, I think it's I don't think it's a good idea, personally.
Thank you, Councilman. We have 3 individuals to address the council on this item. We will begin with Devin Allen, followed by Mark Olson.
Hi, yeah, can you guys hear me?
We can hear you.
Awesome. This is I'm new to the city council process. This is a new step in for me. I guess so. I saw this was a policy meeting, so I signed up to speak, even though none of the agenda items quite matched what I wanted to say. First of all, it sounds like you guys
Devin, you may only speak on our agendized items. So if you have a comment on the city service update, that is appropriate. Otherwise, we have public comment tomorrow at our formal council meeting. So the only topic we are hearing now is city services update.
Okay, thank you for that clarification. hey, it sounds like a good idea to not open those pools. And I thank you for your careful consideration and deliberation on that issue. That's all I have to say.
Thank you, Devin. Mark will be followed by Bruce Ivor.
This is Mark Olson, confirming my mic.
Yes, we can hear you.
Thank you, Mayor and City Council members, for the community service. According to the CDC.gov regarding water and specifically pool water, quote, there is no evidence that the virus that causes COVID-19 can be spread to people through the water in pools, hot tubs, or water playgrounds. Additionally, proper operation of these aquatic venues and disinfection of the water with chlorine or bromine should inactivate the virus, unquote. According to the Weather Channel, quote, expect above average temperatures from June through August, unquote. Amid the record temperatures and the projected record temperatures for the summer, City of Phoenix City Council will be voting whether or not to close city pools. Our own HOA, Homeowners Association, has kept our pool closed. The decision that City Council makes will affect whether or not our HOA opens our community pool. Such a closure affects the community in a negative way. The City of Phoenix swimming pools provide recreation and exercise for all by providing open swim lessons, competitive swim team, and recreational swim for Phoenix Community Center Kids Clubs. There are mentally and physically challenged groups that attend the pools regularly every week. There are kids that spend every day at these pools. The pools employ so many kids for the summer. These kids rely on that summer income to save for college. COVID-19 has essentially taken normal childhood play activities away from our kids and teens. Pools are a safer way for kids to play, exercise, and attain the vitamin D that is needed to build healthy immune systems to fight COVID. A negative decision by the City Council will have a rippling effect in the community that will last for years. I believe a displayed sign stating any laws or statutes that release and protects the business, in this case, the city, from COVID-19 liability would be helpful. Please vote yes to reopen all city pools with all programs and normal operating hours as soon as possible. Our kids' future depends on it. Thank you very much for your help, community.
Thank you for your testimony. Our final public comment is from Bruce.
Yes, Mayor, do you hear me?
Yes, we can.
Okay. Yes, as you said, my name is Bruce. I'm a native Christian. I've grown up with our city pool since I was 8 years old. I'm well over 65 now. I spent many summers in Encano Pool, which kept me out of trouble and from swimming in their canals behind our house. I had a great time as a lifeguard for 6 years in high school and college, and I continue to utilize our city pools as an elder to swim laps and keep in shape, as do many of my fellow elder generation and even younger people. We have something I've never seen in my life, which is the COVID-19 pandemic, which has created a massive problem in our lives. I wanted to ask the city to at least open the 16 of the 29 pools proposed. The cities of Mesa, Chandler, Glendale, and others are opening some of their pools, along with the YMCA, the water parks around the valley, and yet Phoenix pools sit sidelined during this work study, which to me could have been done earlier in the year and preparations made. Many of our Phoenix pools are large facilities. Falcon, Washington, Madison, Sunny Slope pools, and others have very large bathhouses. Doctors are saying evaporative cooling is a good way to eliminate the virus, much better than air conditioning to remove it from the air. Well, all city pool bathhouses have just that, evaporative cooling. Most don't have upper windows in the bathhouse. They have protective chain-like covers so that air can circulate with breezes. Many of these have large dressing areas with social distancing very doable. The large 50-meter pools give swimmers the opportunity to social distance along with the large cement deck areas around the pool. Doctors also say that well-chlorinated pools are quite safe, and Phoenix pools meet that requirement as the staff checks them hourly. I know Councilwoman Williams said open the pool to keep the kids off the street. I agree, but I want to add to that, are we setting records again? We're setting heat records again this year already. Kids want to swim. No pools open. Do they venture the park lagoons, canals, irrigation ditches? Or they send the kids to Johnny's house who has the pool, and you hope an adult is supervising the pool? As we all know, the valley has a terrible history of child drowning. Do we add to that by limiting a very safe environment at city pools with lifeguards watching? One other factor, every year thousands of kids are taught to swim. This year would be a reduced number, but still could be taught safely. I'd hate to lose a child to drowning because forced to seek schooling by venturing in unsafe situations. The other
Thank you.
item is the hundreds of lifeguards.
Thank you for your
that are
testimony. That concludes our public comment on item number 3. Do council members have comments on any city services? It does not appear we have council consensus on reopening of pools. Councilwoman Williams.
I do have a question about the libraries. Extending the hours a couple, is someone from staff there that can tell us if that's a good idea, if that benefits the public, or it's difficult for staff? What's the status?
Mayor, Councilwoman Williams, our city librarian, Rita Hamilton, is here and can answer that question. Rita?
Mayor, members of council, Councilwoman Williams. So we have been doing curbside service, and it's been very, very busy. We're doing 8 to 10 a.m. Monday through Saturday. And because of the fact that we're not providing any evening hours, some folks can't get to the library. So we've decided to add evening hours Tuesday, Wednesday, and Thursday from 5 to 7, and add 2 more hours to Saturday to give people more access.
And you've already made that decision and implemented it?
Pardon me?
And just to be clear, that is to extend the hours of the curbside pickup and drop off. It
Correct.
is not opening the building.
No.
But Rita, what's the timing on the curbside hours that you discussed?
The added extra hours would start Saturday, June 6th, and then that next week following would be the evening hours. But no, the buildings are not open. This is all curbside service.
So for our assistant city manager, it seems like we have we don't have council consensus on any change right now, so pools would remain closed.
Mayor, yes, that appears to be the consensus.
All right.
We will.
Any final comments on city services?
We will continue to monitor the data. We also included in the daily briefing that we provide for council members. So it's something that we'll continue to watch as we move through the summer.
Wonderful. Thank you.
Mayor?
With that, we have any final comments on city services only?
Do you have anything on library?
Mayor?
Vice Mayor, do you have any comments on city services only?
Yes. So I just wanted to take a moment. You know what? It's not on city services, something different.
Okay. Thank you. If there's no comments on city services, then we are adjourned.
Mayor.
Comments on city services only.
No. I don't know where to put this in our conversation regarding policy. So do I have to write a memo there's two things that are concerning me, because before COVID-19, we were able to report out on what we're doing in our community or what we were able to do. And so I want to know where I'm supposed to have this conversation for that to be added to the policy. And then the second one,
Councilwoman, that would be something, as mayor, I set the agenda, and so you are welcome to suggest agenda items.
it's not an agenda item. It's what we used to do at the beginning of policy. It's an update.
Okay, I'm happy to continue that conversation with you.
And then Vice Mayor has something to say, something.
We are only agendized on city services. All right, with that, we are adjourned.